Moi, Quincy, maman Loise, je suis bien identifiée depuis sa naissance, pas d'incuré, un problème cardiaque. Vu que Maurice n'est pas capable de faire ça l'opération, je suis envoyé immédiatement en Inde ici à Bangalore, l'hôpital Manipal, pour faire cette opération. Vu qu'il n'est pas capable de faire avec comprimé, il disait que ça l'opération pour être capable de vivre. Et Maurice a un diamant qui dit 90% l'amour, 10% survie. Nous ici, nous avons fait cette opération d'une phase correcte. C'est l'oxygène avec une bonne injection, mais correct, ce traitement est correct. C'est le docteur Devananda qui fait cette opération. Il vient avec nos enfants. Il fait 3 semaines là, c'était ok. Le docteur Devananda qui dit que nous sommes contents. L'hôpital là, il dit ok, le traitement c'est de la fête, tout ok.
I'm Dr. Devananda, who is the main cardiothoracic surgeon here and also chairman of this particular department. Louis was born to his mother, a normal delivery. But I think when he developed a little breathing difficulty, that's the time mother took him to the doctor. They conducted a couple of tests and they found that he had a very, very major heart problem. In medical terms, we call that as single ventricle, which means he had only one pumping chamber, which is supposed to do the function of both pumping blood to the entire body as well as to the lung circulation. But the major problem apart from this was that the normal flow that should happen to the lungs was not happening. The valve at that stage had completely shut off. There was no valve. So for the flow of blood to the lungs, child was dependent on a structure known as PDA, patent duct, which is an important thing as long as the child is in the mother's uterus. Once we come out of the mother's uterus, we don't need that. That gets automatically closed within a couple of days. But in a child like Louis, if that gets closed, that will shut off the supply to the lungs and child wouldn't survive. So they started the child on a medicine called prostaglandin to keep that open, and all this happened in Mauritius. Then they got in touch with us because the child would require immediate surgical attention for child to survive, and that's how they airlifted this child to here along with an emergency physician. Child came here, we assessed the child, whatever diagnosis they had given. There's a slight difference, otherwise it's more or less the same. And this child, yes, had to undergo immediate operation before that duct closes. We explained the condition to the mother that this is a condition where we need to approach this problem stepwise. And the first step is to create a similar duct. Medically we call it as a BT Shunt, Blalock-Taussig shunt. Once we do this, then we can buy time, and the child is around about say 5 months or 6 months. When child can sit, we have to do the second stage, what is known as Glenn shunt, and probably when the child is about to run around, say around 2 to 3 years of age, we do what is known as frontal completion. Now with which we achieve almost normalcy. I wouldn't say that this heart can be completely called as normal, because whatever that missing portion is there, we certainly cannot recreate, nobody can. But with the existing ventricle, we can take enough precaution and care so that that would last for the life. Now with that, child has gone through the first stage. It's almost now 2 weeks. He is completely recovered well, he's out of oxygen, he's doing fine, he's taking his feeds normal. Now he's ready to go home. But yes, he has to remain under medical care. Probably he has to come back to us once he is around 5-6 months of age.